Good morning, Mr. Yadav. I am Dr. Sharma. How are you feeling today? Good morning, doctor. I'm feeling much better now. The hospital staff told me I was poisoned by a pesticide while spraying my crops. My family and I are worried about what happens next. I'm glad you're recovering well. You experienced organophosphorus poisoning, which occurs when certain pesticides enter the body and affect the nervous system. The good news is that you've responded well to treatment, but it's important to follow some precautions after discharge. Doctor, you mentioned acetylcholinesterase inhibition and delayed neuropathy. What do those terms mean? In simple terms, the pesticide temporarily disrupted the normal communication between your nerves and muscles. Delayed neuropathy means that in some cases, weakness or nerve problems can appear days or weeks after recovery, so we need to monitor you carefully. What symptoms should my family watch for after I go home? Watch for muscle weakness, difficulty breathing, trouble swallowing, severe fatigue, or any unusual symptoms. If any of these occur, seek medical attention immediately. How can I prevent this from happening again while working on my farm? Always wear protective clothing, gloves, masks, and eye protection when handling pesticides. Avoid spraying in strong winds. Follow label instructions carefully and never store chemicals near food or drinking water. Can we keep pesticides in our house if they're sealed properly? It's best to store them in a secure, well-ventilated area away from living spaces, children, food, and animals. Proper storage greatly reduces the risk. Do I need any follow-up visits? Yes. Follow-up visits are important to ensure your nervous system is recovering properly and to monitor for any delayed complications. Let me see if I've understood. I should watch for breathing difficulties or muscle weakness. Use protective equipment while spraying pesticides. Store chemicals safely away from my home and attend follow-up appointments. Excellent, Mr. Yadav. You've understood perfectly. Do you have any other questions? No, doctor. Thank you for explaining everything clearly. Stay safe and don't hesitate to contact us if you notice any warning signs.
Good morning, Mrs. Shah. I am Dr. Sharma. How are you feeling today? Good morning, doctor. I've been feeling very anxious lately. My heart races, I sweat a lot, and I've been losing weight even though I'm eating normally. They told me I have Graves' disease. I'm worried. I understand your concern, Mrs. Shah. Graves' disease is a condition where your thyroid gland becomes overactive and produces too much thyroid hormone. The good news is that we have effective treatments to control it. What treatment will I need? We are starting you on carbimazole. This medicine reduces the production of excess thyroid hormone and helps control your symptoms. Doctor, you mentioned thyroid peroxidase inhibition and radiolytic destruction. Those sound frightening. What do they mean? That's a great question. In simple words, carbimazole slows down the thyroid gland's hormone production. Radioactive iodine treatment, if needed later, works by gradually reducing overactive thyroid cells so the gland becomes less active. Are there any side effects I should watch for? Yes. Although uncommon, carbimazole can sometimes affect the body's infection-fighting white blood cells. If you develop a high fever, severe sore throat, or signs of infection, stop the medicine and contact your doctor immediately. I actually developed a sore throat yesterday. Can I just take paracetamol and ignore it? No. Because you're taking carbimazole, a sore throat or fever should be taken seriously. You should contact your healthcare provider immediately and may need a blood test to check your white blood cell count. The doctors also mentioned radioactive iodine treatment. If I receive it, can I go home and play with my children normally? For a short period after radioactive iodine treatment, you'll need to follow special precautions. You should maintain distance from small children and pregnant women as advised by your treatment team to reduce unnecessary radiation exposure. Doctor, please tell me, is radioactive iodine treatment safe? Yes, when used appropriately. Before treatment, we confirm that you're not pregnant and explain all safety precautions carefully. Let me make sure I've understood. I should take carbimazole regularly, report any fever or sore throat immediately, and if I receive radioactive iodine treatment, follow the safety instructions around children and pregnant women. Excellent, Mrs. Shah. You've understood correctly. Do you have any other questions? No, doctor. Thank you for explaining everything clearly. You're welcome. We'll monitor your progress closely and help you manage your condition safely. Good evening, Mr. Rajesh. I am Dr. Sharma. I understand you've been bitten by a stray dog. How are you feeling? Doctor, I'm very scared. The dog suddenly attacked me and bit my leg. The wound is bleeding. Can I just clean it at home and put a bandage on it? I understand your concern. Because this is a deep bite from a stray dog, it is considered a Category 3 exposure. A bandage alone is not enough. Immediate treatment is very important to prevent rabies. What should be done first? The first and most important step is to wash the wound thoroughly with soap and running water for at least 15 minutes. This helps remove and reduce the virus at the bite site. You mentioned passive neutralization and anamnestic antibody response. What do those terms mean? In simple words, we are giving you two types of protection. One injection provides immediate protection against the virus, while the vaccine helps your body build its own long-term protection over the next few weeks. Why do I need two different injections today? That's a great question. The rabies immunoglobulin RIG is injected around the wound to provide immediate protection. The anti-rabies vaccine ARV is given in your arm to help your body develop its own immunity. If the bleeding stops tonight, can I skip the injections and come back later? No, rabies is a very serious disease, and treatment should begin as soon as possible after the bite. Delaying treatment increases the risk. How many vaccine doses will I need? You must follow the complete vaccination schedule exactly as instructed. Even if the wound heals quickly, you should not miss any scheduled doses. Should the wound be stitched immediately? In many cases, we avoid immediate suturing unless absolutely necessary. The priority is proper wound cleaning and rabies prevention treatment. Let me see if I've understood. I should wash the wound thoroughly, receive both the immunoglobulin and vaccine, follow the complete vaccine schedule, and not delay treatment even if the wound looks better. Excellent, Mr. Rajesh. You've understood correctly. Do you have any other questions? No, doctor. Thank you for explaining everything clearly. You're welcome. We'll start your treatment immediately and ensure you're fully protected.